as Eli mentioned, the presentation for today is evaluation for everyday use. And so I want to, I'm going to try to pay attention to my chat, but Eli, if I miss something, if you don't mind just keeping an eye on the chat so that I can catch any questions that comes up. So I want to just welcome you all to this presentation today. I hear that we have folks from Montana, Wyoming, Minnesota, and Maryland, and then also some MPA students. And so I want to welcome you to this training and thank you for your participation. And I also want to thank you for your service to nonprofits and the people that they serve across the country. Having worked in agencies with Vistas over the years, I can say that your contribution to the life of the agencies is critical. And so thank you for your service. So the plan for this hour is to provide you with some background information about conducting program evaluation. So the title, presentation of this presentation is Evaluation for Everyday Use. And so my hope is that you walk away excited about the process and the product of evaluation, but that you also walk away with some really easy to use, easy to access evaluation tools in your tool belt. So in this presentation, I'm specifically going to talk about, why is it that we evaluate? What is an evaluation? What are some of the challenges that you might encounter or some resistance to program evaluation? And then I'm going to share an evaluation framework by the CDC, some specific strategies, and then I'll leave you with some additional resources so that you can, this is not hard to become an expert in 1 hour, but hopefully you'll have enough confidence to be able to go and seek additional support in these resources. All right, so a little bit about me. So I'm Kate, and I work as a project evaluator at the University of Montana Center for Children, Families, and Workforce Development. So we're a training and resource center, part of the College of Health at the University of Montana. So at the center, I serve as the lead evaluator for Zero Suicide in Montana, which is a 5-year SAMHSA suicide prevention grant. And so this grant partners with tribal health clinics across the state of Montana to implement a multi-sector approach to safer suicide care and health and behavioral health clinics. So I work as the evaluator on that grant. And then I also work as an evaluator on a universal prevention grant for Montana elementary schools that are implementing a universal prevention program called PACS, Good Behavior Game, and then have worked as a contractor and evaluator for different nonprofits and agencies in and around Missoula, and for the Department of Public Health and Human Services. So in addition to being an evaluator, I've worked as a boots on the ground social worker. I've worked as a administrator, as a grant manager, and then also as a clinical faculty for the School of Social Work at the University of Montana. And so I have sort of that multi-layered lens of like, what does it mean to be boots on the ground and actually be implementing programs? What does it mean to be administering the staff that's doing the programs? What does it mean to seek the grant funding? And then how do you kind of support that statewide evaluation efforts? So why the heck do I have a picture of me and my family rowing down the Salmon River? That's because, well, for a variety of reasons, I do love being on the river with my family. But when I think about, the reason I have it for this presentation is that when I think about program evaluation, I really think there's a lot in common with running rivers and whitewater rafting. And so for those of you who might have experience running rivers or rowing boats down the river, you might be familiar with this, the strategy of, before you come to a rapid, you pull over onto an eddy, you get out of your boat, you walk down the river, you take a glance at the rapid from above, so you can get a sense of like, okay, what are the features that we want to definitely miss? We don't want to hit that rock, we don't want to get into that hole. Here's the line that I think I'm going to take, right? And then there's times where you're you're in your boat and you just, try to read the river as you go. And so you may not be big enough where you have to get out and scout, but you do what's called read and run, right? You're rowing your boat down the river and you're just like figuring it out as you go. Or you've scouted the river, you come up with a plan, and then all of a sudden, like, you hit a rock and now you're going down a different channel that you hadn't anticipated. And then you got to figure that out as you go too. And I think that running programs and evaluating programs is a lot like running rivers, right? You have a plan, you get out, you get that kind of, 25-foot view or 10,000-foot view on the program and where you want to head down the river. And so it's great to have a plan. And then there's also times where you might hit a rock and pivot, and all of a sudden you're going down your plan is now backwards, and you're having to figure that out as you go along. So as I go through this presentation, just keep this river running, analogy or metaphor in mind, that whatever we do requires a good plan, but also requires some really good flexibility to be able to go with the flow. All right. So in our roles in nonprofits, we're often asked to do more with less, and program evaluation takes time. So why evaluate? So we evaluate because it helps us improve our programs. So if a program isn't effective, then we do a program evaluation. It helps us understand how we can improve, what activities we should continue and build upon, and what activities should be modified. Program evaluation can also really inspire staff performance, right? So we use our program evaluations to identify those strengths and opportunities. Where is our staff really excelling, and where are areas where maybe we need to provide a little more training so we can better serve our program recipients. Evaluation also demonstrates the impact of our program to our funders, right? So all of our agencies are relying on those external funding sources. And so all of the funding sources are going to ask us, well, did you make an impact? And so we can anecdotally say, yeah, that family really was well served by us. But if we really need to have a solid evaluation to articulate how impactful our program is, how well we did what we said we were going to do. It also provides this program clarity, right? So that everyone knows, so everyone, including your staff and your volunteers, your funders, the community at large, they all have a sense of where you're headed, right? What is your route down the river? And most programs need additional funding, right? And you need to raise that additional funding, whether it's through, look for fundraisers or writing grants, whether they're foundations, whatever it may be. And so an evaluation can really help paint the picture of the importance of the program so that you can raise more money. All right, so now I got my goofy cartoons here. So here's this cartoon, and it says, the guy on my left says, you have a board meeting coming up, and we could really use a little input from the evaluation team. And then she says, sorry, we're not scheduled to provide input until year 3, right? So we know that this is really a common response. And Eli said, this is the last training. And it's really important to be able to know kind of, did you make an impact? And yet when we secure the funding, for example, it's not uncommon. They're like, oh, great. Now, crap, we're seeing it's the end of year 3. And now we need to evaluate whether or not we had an impact. So I want you to kind of keep that in mind, that we do have a tendency to fall in that camp. And then I hope you walk away today with like, oh, I get the grant. I found out that I had the grant today. Tomorrow is when we're putting our evaluation into place. Okay, so when we think about an evaluation, we typically think about them in these 2 different buckets: a process or an implementation evaluation, and then an outcome evaluation. So when we're thinking about the process evaluation or an implementation evaluation, the primary question that leads these types of evaluation is, did we say what we were going to do, right? So let's say, you wrote a grant and you said in your grant, here are the activities that we're going to do, right? And so a process evaluation allows you to monitor whether or not you're doing what you said you're going to do along the way. we want to make sure that we're evaluating this process along the way versus at the end, because then the downside of at the end is like, oh gosh, we should have really pivoted, after year one, and yet now we're not finding this out until the end of the grant cycle, right? And so we want to make sure that we're engaging in this process evaluation as we go along, so that when we gather information, we can also pivot. Also, in terms of process evaluation, and something that I'm really using to inform my work, and this is a whole other presentation, so I'll just give you a snippet, but it's this idea of implementation science. So implementation science is really about getting what works into the hands of the people who need it. Right. And so, this, evidence-based programming or empirically supported programs, all that is essential. We want to make sure that we're using those really sound models to impact the people that we serve. And yet it doesn't just work to say, okay, I'm going to take an evidence-based program and it is going to work. There's all these pieces in the middle that, in terms of implementation, that are essential in order for you to take what works and get it to the hands of the people, right? So do we have the proper training do we have the right people hired? Do we have the right trainings and coaching in place? Do we have the right leadership? Do we have a data-informed model that helps us understand kind of our progress along the way? So that's just like a long-winded way of saying that implementation science can really help inform that process evaluation. And kind of the thing to remember on this is that it's not done at the end, it's done intermittently throughout the tenure, the life of your grant or your program. Okay, so then we get to the outcome evaluation. So process evaluation is, did we do what we said we were going to do? Outcome evaluation is, well, did it even have an impact? And so an outcome evaluation really measures the program effects in the target population, right? We said we were going to train up families. Well, did they learn anything? And so oftentimes this includes those short, those medium, and the long-term outcomes. And logic models, which I'll talk about in a little bit, can really help us inform this outcome evaluation. Now, that's a lot to share in one slide, but I'll say that most evaluations have pieces of both process and outcome that are part of the evaluation plan, right? And then I guess, Eli, just pop in and tell me if I have any questions. Okay, so evaluation helps us to make sure that we're doing what we said we were going to do, and it helps to uncover if we're even having an impact. Then why the resistance, or why do we wait until year 3 of a three-year grant to begin the evaluation process? So I want to share some common concerns and then kind of my responses to those concerns, and whether or not you might relate to the concerns. It's good for you to have this sort of in your mind, because you're going to be trying to get people on board, and so you want to be prepared that this might be some resistance that you'll encounter as you try to launch your evaluation. So a common concern is this idea that evaluation is diverting resources away from the program, and therefore it harms participants, right? So, this is this concern that you're already operating on a shoestring, and if your staff is doing this, then how are your participants going to be harmed or impacted by these evaluation efforts? And my response to that would be that you're already, that an evaluation will help you determine what does and does not work in a program. And because of this, because it uncovers what works best, it's actually very beneficial for your participants. So without an evaluation, you're providing services with little or no evidence that they actually work. And that is harmful to your participants. And even the best, like I said, evidence-based program may not be actually working in your agency, because you don't have these other pieces in place that support sound and effective implementation. So how harmful, so that's harmful to your participants. So they're not getting the potential of the intervention because there's not these other pieces in place. So an evaluation will help you uncover that. Again, there's this idea that evaluation increases the burden to program staff, right? Again, you're having to do much more with less. That's sort of the theme, I think, oftentimes. So, the reality is that oftentimes program staff are already collecting information because they're most familiar with, or they have the most contact with program participants. So this can increase the burden because let's say they're disseminating, they're running focus groups or they're doing surveys, right? But they also can really help benefit the staff, right? Because it helps them improve their work with participants. So they learn more about the program, learn more about the participants' need. And it can also really validate their successes. Like, gosh, we've really been working hard in this particular area. And the feedback that we're getting from our clients is that it works. And so that's very validating. It can kind of revitalize your efforts. Okay. So let's see. Another concern is that evaluation may produce negative results and lead to information that makes the program look bad or lose the funding. So that's certainly true, that evaluation may reveal problems in your agency and may, problems that your agency encounters in terms of doing the work. But you might also encounter successes, and both of this information is really important. So, I think it's hard, especially when we're in sort of a scarcity mindset in our agencies. It's hard to say this idea that we're going to find out negative things that are going to impact our funding. However, I would encourage you and your leadership to really take on that more of the abundance perspective, this idea that the more information that we have makes us smarter. And the smarter we are, the more effective we are. And that when we get negative feedback and negative results, gosh, we're smarter because of it, right? Even when we're failing or learning. And so that spirit of program improvement is sharpened even more when we get that negative feedback. And that's, again, goes back to that kind of read and run, the river analogy, right? Is that, gosh, it's way better to learn after year 1 that you have negative results than after year 3 when the grant is done, right? Because if we take this read and run perspective, we can really pivot, right? And choose a different channel to go down the river. There's also this idea that evaluation is too complicated. So, there are certainly, I'm seeing this trend in terms of working with federal grants that they hire ask for these like local performance reviews where they have an external evaluator come in. So I've done that for agencies where they had a grant, they're running a program, and I don't work at the agency, but I come in to help them design and implement their evaluation. And that certainly can be complicated, but there's plenty of things that you can do as administrators of a program that aren't necessarily technical. And so, you're already, I would imagine, collecting input from your participants, for example. And so there's no need to outsource a lot of this work. There's things that you can do as a program from day 1 that don't require that external support. And again, my hope today is that you walk away with some tools that you can implement right away. So any other concerns that you've heard of? And I don't know, I've got my screen shared, so I can't really see the chat, but anything else where you, oh wait, here's my chat. Anything else, any other concerns that you've heard of in your agency, or that you have a concern that I haven't addressed? So use your chat to share your ideas. If anything that I didn't bring up and that you want to make sure that we talk about in terms of a concern. And I'll keep my eye on that while we go to this next goofy slide here. So the guy with no pants on here, looks like he has no pants on. He says, you know, we've got it wrong in the past. And then the lady with the really perky eyes says, yes, but we learn how to do it right for the future. So that's really the spirit of evaluation and a program improvement. It's like, yeah, we might find out that we're not actually nailing it, but man, we want to know how to do this better in the future. And so that really does require that, you know, cultivating the spirit of program improvement and of abundance, even in a scarcity time. And then let's see. Okay, so hi, Molly. So traditional forms of evaluation don't capture the impact of non-countable impacts. So emotional support, for example, is hard to capture, and an impact on an academic mentorship program. My concern is that numbers don't tell the whole story. Awesome. Okay, so what Molly's talking about, I'm going to talk about here in a bit, where we have oftentimes we look at quantitative data, so numbers, you know, how widespread our impact was, but that doesn't always tell the nuance or the story of the impact. Oh, that was Natalia using Molly's Zoom account. Okay, hey Natalia, if you're with Molly, tell her I said hi. So that it doesn't tell the full story, right? And so we want to make sure that that we're also designing evaluations that tell the heart of the work. And so I will get to that. Okay, I got my chat open, so keep chatting in some questions or adding in some questions if you have anything. Okay, so this here you might be familiar with. This is the evaluation framework from the Centers for Disease Control and Prevention. And this is a common evaluation model that's used to evaluate public health programs. And so you see it's sort of this iterative process where we're engaging with our stakeholders, we're describing the program, we're focusing our evaluation design, we're gathering the evidence, justifying the conclusion, and then we're using and disseminating the lessons we learned. So that's what we're going to talk about next. All right. Okay, so engaging stakeholders. So when we think about stakeholders, we typically think about them in these three different categories. So we think about one is those that are involved in operating the program, right? So those are your coalition partners, your funding officials, your staff, your managers, your administrators. And then another stakeholder category is those that are affected by the program. So that means your clients, your family members, neighborhood organizations, elected officials. And then third category would be the users of the evaluation. So those that get the results and they're in the position to do something about it. So this is you know, again, program staff and administrator. So I want you to think about in the work that you're doing, who are the stakeholders that you would want to engage in an evaluation? And I'm going to keep chatting while I keep my eye on the chat. So just use the chat again, the sort of active learning process here. Start thinking about who are some of the stakeholders that you would want to engage with. And I'm going to provide you an example. So this study here, this is from the Green Care Farms in the United States, a feasibility study that I participated in several years ago. And just a little background on this study is that Green Care Farms are actually, they're working farms where adults with disabilities engage in activities ranging from, you know, feeding and caring for animals to harvesting vegetables to preparing fresh meals. And home and community-based care options for adults with disabilities are pretty limited. And within each care approach, like an adult day center, for example, there's real limitations. And so we looked at the feasibility of this first green care farm in the United States, which was up in the Flathead. And so again, working on these farms is an alternative or an additional kind of option for adults who might, you know, go to an adult day facility for the day to give their caregivers a break. You know, they would go and play bingo and have lunch or whatever it may be. And this is a different way of engaging with the community. So in terms of this project and our stakeholders, we had, you know, administrators from those traditional home and community-based services and the adult day services. We interviewed farmers that were using their farms in this way. We interviewed participants to better understand their experiences, and then we interviewed family members of participants as well. So again, I'm going to keep moving, but I want you to keep thinking about who it is that you would need to, who are the stakeholders that you would want to engage in your project. All right. So the next part in that CDC framework for evaluation is describing your program. So when we think about describing our program, we think about how it is, what's our, we're in an elevator and we're working with the funder and we got to go 6 floors up, right? What is it that we want to say that's going to accurately describe the program so that we can get funding? So we're going to need to talk about why our program exists. So what's the need? What are the resources that we have to address the need? What are the activities? So like, what is it that we're actually going to do to make a difference? How much of that are we going to do? And what's going to be the impact of our program? So when we think about the evaluation model, we need to think about how it is that we understand all these different pieces? And a logic model helps us do this. So I would love just if you could in the chat in like, I love logic models. I have no idea what a logic model is, or I can't stand logic models. I just want to get a sense of like if you've used them and what your experience is. So if you could do me a favor and just use the chat in that way, that would be helpful, and I'll keep chatting here. So logic models, no idea what a logic model is. Okay, good, great. So okay, perfect. So I'm a fan of a logic model. Logic models are one of those things that people either seem to like love them, hate them, doesn't really work for them. But I think there are pieces, even for the people who are a little skeptical, I think that logic models can really help you describe your program, define what it is you're doing and how you're going to have an impact. And so I really think of them like a roadmap, that it is a way to plan your route. And I will say that for those of you who are applying for grants as part of your program, whether you like them or not, whether you think they capture the whole scope of the program or not, some grants will require you to submit a logic model as part of the application. So let's talk a little bit about what a logic model is. So in its most simplest kind of version here, this is an everyday example. So in this example, our problem and our need that we're trying to address is that we're hungry, right? And so what we need to do is we need to identify the resources, which are food. We need to get food. And the activity is that we are going to eat the food, and the result or the outcome of this is that we feel better. Okay, this is a logic model in its most simplest form. So this is a little more complicated logic model here. So I think one of the most critical pieces of this is, see the black arrows? The black arrows are really important because you want to make sure that everything that you do is connected back to the problem statement and the goal in which you want to accomplish. So the problem statement is generally the first step in creating a logic model. So why does your program exist? What are you trying to accomplish? So let me just share with you an example that when I worked with the program and did their evaluation, this is what they were addressing. So this program was, the problem was that in their region, in the state, there was a lack of recovery support services for folks with substance use disorders. And there was a particular lack of availability for people in the community that were seen as particularly vulnerable. So homeless, have HIV, that are IV drug users, they may be pregnant, have a history of incarceration. And so their goal was to establish a peer support program, a peer recovery program that provided an additional option in the menu of support services, with the goal of really serving this population, patient population that was really, or community population that was really vulnerable. Okay, So there's the problem, lack of resource, lack of support services, and the goal was to establish this program. So when we get to resources, that's where you're really thinking about what are the things that we have in place that can help us be successful, right? So we've got staff, we've got volunteers, we've got a building, we've got an IT person, we've got access to online trainings. You're writing down everything that our agency's invested in so that we can be successful. Those resources then lead to activities. So what are the specific actions that make up your program or intervention? So in the agency or the program that I was just sharing about, it was about peer support programs. And then there was also like this training model for peer supports. So for your agency, it might be that you educate, that you run an after-school program for K through 5, that you are doing a community supported agriculture. So you're trying to, launch 5 new garden spaces and engage new community members. The next one is your output. So these are your deliverables or your measurable and tangible products. So this is like, we're going to launch 5 new gardens. We're going to partner with 10 new elementary schools. We're going to provide 500 meals this quarter, whatever it is. A lot of times when we think about evaluation, unfortunately, we stop here. We stop at outputs. This is the number of things that we did, right? But that doesn't really tell us an important important part of the story, which is, well, so what? We provided 500 lunches, now what? Or we provide all this trainings, were they effective, right? And that's where the outcomes come to play. And oftentimes in a logic model, you have the short-term ones, like the low-hanging fruit, the medium, and then the long-term outcomes. And again, it all feeds back to the goals of the program. So I want to talk a lot about these outcomes because this is pretty important for our evaluation, right? So when you think about developing a logic model, which again can be used for a variety of uses, and particularly for evaluation, we want to start with the end in mind. What is it that we want our participants to get out of our program? Why are we working so hard? What is it that we want them to get out of this, right? How will we know that they're making a difference, right? What change? We want to know what will change for our participants because they experienced or they participated in our activities. So logic models, again, this is just a little plug for them. They can be really linear, like I kind of gave the example of like the boxes, They can also be really creative. This is one that looks like this is like an after school kind of agriculture project for children. I just got this off the internet. But again, they have, their outcomes are under that kind of shed, their activities are, in that flower, the sunflower, the outputs, like how much of whatever they're going to do is in that other kind of flower without, So you can see what I'm, the inputs are at the bottom, so you can get creative with this. Another example, this is not a very good picture, but I just wanted to share this with you that I attended a conference for American Indian, Alaskan Native Injury and Violence Prevention Conference. And this is around this particular training was on Indigenous Evaluation. And so this is from the Seattle Urban Indian Health Center. And so they showed an example of a logic model that really does tell a story, right? Which is very much aligned with the community that they were working with. That is that narratives and storytelling is really the foundation around their kind of cultural connectedness. And so they developed a logic model that really better aligned with the spirit of their work. So while at first glance, logic models can be pretty sterile or very linear, I think you can get creative with it. And again, even in this kind of this narrative, this picture, the storytelling image, you still see the arrows, right? You still see that the activities are leading to the outcomes, short and long-term outcomes. And so that's kind of the key piece. Logic models can be tough to kind of get started, and I've provided the slides and I've provided resources, and there's plenty of other things out there that you can get started with, and there may already be a logic model for your agency, so it's worth asking. But I want you to just take a moment to like pull out your piece of paper. If you're taking notes, I want you to think about the program that you're working in, and I want you to think about the outcomes. And so you can kind of think of logic models in kind of two halves. One half would be like the inputs, and then the second half inputs, which would be like all of your resources and your resources, and then your outputs and outcomes is kind of like what it is that you're doing with your program and the impact. But I want you to, for the sake of this, is just focus on the outcomes. So starting with that end in mind, just take a moment to make a note. In your program, what do you want your participants to get out of the work? And then how will you know you're making a difference? And then what change do you want your program participants to experience because they participated in your activities? So I invite you just to briefly write that down. Again, starting with the end in mind. Because whatever you come up with here is really going to guide your evaluation plan, right? If you want them to if you want to improve school climate, right? If that's a really important part of what the work that you're doing, then you're going to have to figure out, okay, how are we going to measure school climate? And so it really does inform your evaluation model. Okay. So again, I want to just plug us back into this framework because logic model took us down a certain path, but we've talked about engaging stakeholders, the describing the program. The logic model can be a strategy to do that, to help us better understand what it is we're doing and the impact that we want to have on our program participants. And now let's talk about focusing the design. So again, when we think about focusing our evaluation design, it really is informed by the logic model, and particularly the outcomes that we're hoping for, right? So again, if you want to improve school climate, what it is, how will you measure school climate, and what's the data that you need to collect, right? I'm working on a project right now where we are looking at school climate, right? And so we want to do a pre and post test. So we know that that's our outcome, like did this intervention improve school climate? But now at the beginning of the year, we have to collect, we have to do a survey to better understand how do kids assess their climate now? And then at the end of the year, did it change? So that's why having the end in mind is really important for when you start your intervention. So again, thinking about what's feasible, ethical, useful, what's your timeline and your purpose of collecting data. And so you can see the more you get into program evaluation, the more you can see why if you start at the end, it's too late. So again, focusing the evaluation design. So this is that data. So this is the email from let's see, Natalia. She was talking about kind of how do you, sometimes the numbers don't tell the full story, and I agree. So when we think about data, we often think about it as quantitative or qualitative data. And this is kind of going back to your early days of school, I'm sure, but essentially, quantitative data is those like numerical data that can be counted and quantified and analyzed. And so some examples are like, achievement test scores, the number of program recipients, satisfaction ratings of AmeriCorps members, right? Those pre-post tests. Those surveys and assessments and tests, those are the most common ways of obtaining that quantitative data. And then we have the qualitative data, and those are ones that aren't easily reduced to numbers, but rather they're narratives that inform or describe the study or the subject's experience, right? And so this could be transcripts of interviews or focus groups. And I'll talk about this in a little bit, but they really can speak to the nuances of an experience. So an example of a study that I'm involved in right now is we're looking at COVID-19 and suicide prevention, and how suicide prevention efforts have shifted due to COVID-19. So first, we're doing a statewide survey of behavioral health and medical providers. So it's all quantitative data. There's no open-ended questions in the survey. So we'll collect that information to understand how people are pivoting or not. And then, like, that's not going to tell the full story. So then we'll use that data to then say, okay, where do we want to further, what else do we want to learn, or what's curious about this data? And then we're going to conduct interviews with behavioral health and medical providers to understand the creativity to the pivot or the burden to the pivot. And so that's going to help us tell the full story. And so it's ideal when you can combine both quantitative and qualitative data. So I've talked about surveys, focus groups. Those are, where you're getting groups of people together to ask the questions. That does require, a little bit of additional expertise, just in the sense of doing some of that thematic analysis, but you can definitely do that in teams, and I think it's not beyond your, even whatever your level is, that I think can be learned. Same with interviews. Participant observation. So if I'm wanting to better understand a school climate, is there someone that can observe the classroom and look for certain metrics? There's kind of pros and cons to that. Having an outsider in observing may change the dynamic, but there are ways to kind of tease through that. Data review is another data source, data that can be helpful in your evaluation that I just did. We looked at the policies and all the procedures, and to see kind of if they were, how they had incorporated some of the recommendations from the previous year. So those are some examples of data that you can collect that your agency's probably already collecting. One thing I want to say too about surveys or focus groups or interviews, one thing you want to just be mindful of is whether your involvement let's say you're a boots on the ground, a service provider, whether your involvement in collecting this data will impact a person's ability to be, candid. So one thing we did when I was working with a domestic violence program, we wanted to know about, get some feedback for their shelter residents. And so the shelter residents who were typically there, they stayed there for 2 months at a time. So we'd have them fill out surveys, and then we wouldn't open the surveys for 3 months, so that we could ensure that the people that were living in the shelter, that their confidentiality would be maintained, right? So while the program couldn't pivot quickly enough for that participant, there was a kind of a process of quality improvement, but also a process of respecting the confidentiality. There may be like focus groups or interviews, you may want to call in someone from a different program to come in and do the focus groups and interviews. Or you may decide that you have that rapport and relationship, and so it makes sense for you to do it. So those are some of the things you want to kind of keep in mind with the collecting the data, which leads us nicely to, well, here again, focus more on lives changed and conditions improved than just on numbers served, right? So it's not enough to say that 100 people attended your training. Like Natalia mentioned, we want to really understand and capture the impact of that training on your participant, for example. So again, this credible evidence, that's another part of this CDC framework. And this is really about kind of understanding what I talked about earlier, like who's going to be the most appropriate one to collect the data. It's around like indicators. So like, what are those quantitative or qualitative variables that will change as a result of the intervention? So what are we going to measure along the way? And again, we start with the end in mind so that we can implement that and track that at the beginning of program launch. And then logistics, what's feasible for us to, is it feasible for us to go and observe? Well, probably not, but let's do this instead. And the main point I want to focus here is that evaluation, it's such an opportunity to amplify the voices of our participants, many of whom don't have a voice. And so the way you design an evaluation, you really can do it in a way that captures the voices of folks who have historically been marginalized. So you're probably not unfamiliar with a strategy called photo voice, which is a process in which people, oftentimes those with limited power due to poverty or language barriers, race, class, ethnicity, other circumstances, where they're using video or photo images to capture aspects of their environment to share their experience with others, right? So again, this goes to Natalia's question about how do you capture the essence of the program? Well, this could be a really creative way to do it. You probably would also need the numbers, to kind of talk about the scope of impact, but this is the heart of the impact, right? So this is, this is from the view of someone with a spinal cord injury. So our community through the eyes of people with spinal cord injury. And so really being able to accompany this, like to think about with policymakers, like have them really understand the experience can be really powerful in addition to the other data. This is one with kids, right? So talking about an after school program with kids. So here's another creative survey that I want to tell you about. And again, talking about how do we capture the voice of folks that we don't always hear from? Well, kids, right? We don't quite give kids always the credit that they deserve in terms of knowing what they want and don't want and giving feedback. So this is a social work student of mine from a while ago. She gave me permission to share this, and she was doing a practicum at the food bank. And the food bank runs a program, a food program, like after school program, provides food to these after school programs so that kids have snacks after school. And so she was tasked with go find out what the kids want. And so she went to, anyone ever run an after school program know remember those after school programs? Wow, in person where we all could be together. It seems like forever ago, but essentially she went to these programs and it was chaotic. And the kids were like, going nutso because they have been sitting in school all day and they wanted to play. And so she realized really quick that it was not going to work to go around and interview these students. And so instead she created this survey, very, very quick survey where there were 4 questions. These are the first 3. And so any kid can have limited literacy, can really read and understand this. I think she maybe read it to the younger kids. I'm not sure how that worked. But how hungry do you feel after school? How hungry do you feel after eating the snack? Do you bring snacks home to eat later? So those 3 questions are really important for a food bank to make sure that, are we giving our kids enough food? Do they need more food? And are they needing to bring this food home to their families? And then she wanted to know what foods they like. So obviously this is all food that they could provide versus I'm sure the kids really wanted to, add in ice cream and donuts and whatnot, or at least my kids would. But so circle what you like and circle and cross out the ones you don't. Then she collected all of this and she created a report. So it can be and should be creative and really meant to amplify the voices of the people that you serve. And this is, I think, a really nice example of doing that with kids. Okay, so this is that justifying conclusions or analyzing the data. Well, earlier I talked about how a resistance maybe to evaluations is that can feel complicated. And I would say that it can, but it also doesn't have to be. So get a team together to look at your data. So look at your photos, look at your surveys, look at your transcripts, and together you work on analyzing and synthesizing the data, right? It's really, even when I'm hired as my own contractor, like one evaluator on a project, I always bring in a team to help me look at the data because I'm either too close or too far, and I need all those multiple perspectives. So you get a team together to look at this data, summarize what you find, and then put them into these findings. You always want to identify what are the limitations, what did we miss? We tried to do focus groups last year with schools, and there was COVID happened, and no one was going to school. And so that was a limitation. And then from that, you're building your recommendations. And that's again, where you're really relying on your team. Okay, so no one likes an evaluation when someone says, here, do the survey, but then you never even use the data. So you really want to make sure that you're learning from your evaluation results, that you're disseminating your findings, that you have a systematic way of reviewing all the data you collected. And this is really about creating a culture, an organizational culture that is data informed and data driven. And it sounds boring at first, but really it's the heart of the work that we do. And when we're talking about data, it's not just like a number on a paper. These are the people that we serve. And if we don't have a systematic approach to collecting their input and making changes, then we probably need to, I don't know what, shift the work that we're doing, because it's so essential to being able to provide effective and ethical services. And then we think about, like, how is it we want to disseminate our results, right? So who are our stakeholders and how can we inform our stakeholders? And again, this is a really good way to be creative, right? So you will probably write a full report, and there will probably be a handful of people that will read your full report. I think about that a lot when I write these reports. I'm like, really what they're going to read is my executive summary, right? Or that one pager. So thinking about really getting creative about how to present the findings. Like we have a short attention span in this world. And so how can you really maximize your hit, your impact on these one pagers? And I'll show you some examples. Presenting case stories or stories of impact, right? So again, this gets to the heart of the work. So you have the data and the numbers and the full analysis to be able to back it up, but you're really grabbing a hold of their heartstrings through this case study or impact story. And you can also disseminate using like a press release or a letter to the editor, snapshots, postcards, videos. There's so many creative ways to be able to share your findings. And then again, you're thinking about, who are your stakeholders and how do you want to, and you want to become strategic. Like, we think that this foundation is a potential funder for us in the future. Let's send them our report. Let's invite them to our presentation. This is my last goofy slide here in my cartoons, but we spent the last 3 months writing the report. We drained the budget. We're unable to share it with anyone. So again, thinking about when you're building a budget, you're also building the setting aside funds to be able to disseminate it in a creative way. When I contract for evaluations, I always hire a graphic designer to help me really create a nice looking report. I've worked hard on it and I want people to read it. And if it looks pretty, if that's going to help, then it's well worth the money. So again, here's an example of a one pager. Here's an example of a one pager that I did with a designer. So again, it gave kind of the overview of my program, what my overall findings were, and the stakeholders and whatnot. So again, this accompanied my full report, but it made it really easy for folks to read. And there's a lot of text on this one. This one's even, I think, easier to read. So thinking about those numbers, the stories, and also good to pull out quotations. I think, this one has those quotations. This is a teen parent program I evaluated. And so pulling out those quotes that really demonstrate the findings. And so where the heck do you start? Well, I'm a logic model kind of a gal, but I think whether you do logic model or something else, that really understanding what it is you're doing, why you're doing it, and what's the impact that you hope to have. And so you do start with the end in mind, and then you're building backwards. And I also really encourage you all to be creative. And it does not, evaluation, if it's boring, you're not doing it right. There's so many creative ways to capture feedback and input and impact. And so, you know, your teams are great resources, your participants are great resources. And so I just encourage you to start to get creative, because that's going to make you want to kind of stick to it and also share the story of your program. So my last slide here is just some resources. So these are, again, the Center for Disease Control and Prevention. They have a lot of resources on program evaluation. And then these next two are also great resources. The University of Wisconsin Cooperative Extension and the Community Toolbox, which I think you probably have seen other sessions, but those are really helpful, tangible, how to get started. So this is my last slide here. We only have a couple minutes, but I just want to open it up to any questions or comments. My contact information is really small on this slide, but you know, please reach out to Eli if you have any questions, and if I could be helpful to you at all, I'm happy to make myself available and help you get started, or help you think through or be a thought partner with maybe some challenges that you've encountered along the way.